Welcome to Maryland Medicine Frontline News. Coming up, how the Department of Psychiatry is using technology to improve care for schizophrenia patients. But first, we take a look back in order to move forward in the fight against COVID-19. At the height of the pandemic, scenes like this were common in the news, with doctors and nurses donning personal protective equipment, or PPE, to protect themselves from COVID-19 infection. In COVID units like this one in the University of Maryland Medical Center, a powered air purifying respirator, or PAPR, offered the highest level of protection to faculty, physicians, and staff. One of the most common forms of PPE is the N95 respirator. Meant for a single use, N95s were in short supply around the country early in the pandemic. Luckily, the medical center already had a large number of reusable respirators, which were purchased in 2009 in response to the H1N1 pandemic.
So this is an elastomeric respirator, and the face piece, what comes over your face, is shaped like a triangle, so you kind of get the idea. Might look like something like a mask we use when we are going snorkeling or something like that. But the material is not the pressed paper that an N95 is made out of. You can see that it kind of gives, and it's got two little ports on each side, and you can actually remove the filter. This permitted us to be able to use them over again.
The effectiveness of the system is being studied by Dr. Stella Hines.
We asked healthcare workers to think of a hypothetical but high-risk situation, such as care for a patient with active tuberculosis or care for a patient during pandemic, SARS, or influenza. And we said, which respirator would you prefer to use in this scenario? And despite the lower scores on communication and on comfort, the elastomeric respirator users still preferred to use that respirator for a high-risk event.
Now a new respirator system called CleanSpace Halo is being added as part of a tiered strategy to expand availability of PPE. It's an air purifying system that's reusable and rechargeable.
It is an electronic respirator device that actually has a much higher filtration and air exchange system that can be used. The nice part about them is that the masks themselves can be used amongst various providers. They are disinfectable.
That not only do we have multiple different strategies and equipment, we have backfill to all of our PPE strategies, so that not only do we have a series of potential options, we actually, for all of those options, have a warehouse behind it so that we will be able to address the constraints around PPE if they have any in the future.
COVID-19 has made telemedicine commonplace, but the Maryland Psychiatric Research Center was ahead of the curve with a new study to increase the use of an important schizophrenia treatment.
Clozapine is an antipsychotic for the treatment of schizophrenia and some other disease states as well. Clozapine has been around for over 30 years, but unfortunately, it is very underutilized. So in essence, it's actually the most underutilized evidence-based treatment in schizophrenia. Our project is a unique intervention where we're actually focusing on providers in the community, as opposed to recruiting patients into a clinical trial. Our clinical trial is going out into the community to physicians, nurse practitioners, and physician assistants who are going to be able to perform the Project Echo teleconferencing to the outside sites. We're going to be doing 26 sessions over a 1-year period. So every other week, we're going to be holding an hour and 15-minute session where we'll be able to do a didactic, and that's 15 minutes of about a 15-minute session where people can listen to us talk about the topic of the week and go over different aspects of clozapine. But then the second part of the Project Echo, or the Champion Project, is the last hour is going to be for consultation and discussion. So what it does is it allows people at all the different sites to be joined in a teleconference format, but be able to present cases and have a discussion where we can all use the camaraderie, the expertise, and feed off of each other to be able to use experience and expertise to guide the best care and involved with the cases being presented.
That's Maryland Medicine Frontline News. I'm Larry Roberts. I hope you'll join us next week.
airflow feels good, so now you're going to clean your